flush your extension tubing, which will come in your package. And then you can have your vacuum trainer if you're going to draw blood off of the IV, but tomorrow we will not be doing that. And then your arm, your gloves, and everything should be in your IV start kit. So, in your IV start kit, you have, I already went over this, you have your cleaner, make sure they're not allergic, your tourniquet, your tape, and your tegaderm, and your best friend, gauze. Okay? So, what I'm going to have you guys do is I want you guys to get with a partner before you start the IV sticks. Put a tourniquet on your partner and find a vein. I want you to be able to find a vein lower down and higher up on the AC. Mine right here, it's good and juicy. You can see it, right? That's the one that they've marked up. You can feel it. So if you guys want to feel on yourselves or if you want to feel on a partner, you're all going to have to do it either way. But feel, so I'm going to tell you guys, your fingers are going to become your third eye, right? So I can feel that that's a vein right there. If I feel right to your guys' left, okay? Your guys' right, my left. I can feel a tendon. I know it's a tendon because it's not bouncy and it's hard. Sometimes dialysis patients, their veins will feel like tendons, but you guys will become experts and know the difference. So this, I know it's a vein without looking at it because it's bouncy, and I hold pressure on it. And I know it's not an artery because there's not a pulse when I hold pressure. Okay? You don't want to start an IV on an artery. It's bad news bears. So with that, I can find the base of where I'm going to insert the needle, but I can also follow the vein up my arm because I'm still feeling the bounce, and I can follow my median all the way up here. Okay? If I feel over here, I feel a little ridge, and I press it, and it's bouncy. So I feel a little bit lower. Can I insert the needle a little bit lower? Yeah, it's still good right there. So I'm probably going to insert my needle there, and I'm going to follow it up just to make sure it doesn't bifurcate or have a fork in the road, because the veins can sometimes split like that. Sometimes you can see it, but not always. Sometimes you can see valves, but not always. That one's a little bit harder to see. So that one's a good one. That's my cephalic. And then my brachial, actually I can feel my brachial right now too because I'm probably not that hydrated, or I'm overhydrated with coffee. But you got to be careful because everybody feel your brachial right now. Feel for brachial vein. You have your brachial artery right there. So that one's a little bit trickier because you can accidentally get the brachial artery. Okay? So those are for your ones up there. Not everybody's going to have really good feeling veins. And then of course you can go down and you have your forearm veins and your hand veins and all those things down there. But these are like the big three main big ones. Yeah, he's got really good veins. But not everybody's going to have good veins like that. Get him! Okay, so before you guys get started, I want you to put a tourniquet on somebody else and feel for the vein. Yeah, you can look, but I want you to be able to look away or close your eyes and feel the vein and follow it up, okay? All right, so now we'll get on to this. So, same thing as a blood draw. So this is easy because we already went over a lot of this stuff. You guys already know how to apply the tourniquet. I'm gonna apply, okay, I guess he wants to go that way. So we're gonna apply the tourniquet. Find your vein and get all your stuff set up here. Actually, we'll let that plump up a little bit, and I'm going to get all my stuff ready. Same thing with my tape as I did with the blood draw. You have your gauze ready. Now, this is a trick that I use, so you guys take this with you if you want. Now, this needs to stay sterile and clean until you're ready to use it, okay? So you cannot leave it open like that. However, what I do beforehand is I just fold like a little corner there. See how I did that? Nothing's exposed. That way when I'm ready to put it on, I just pull back like that and it's ready. Okay? But you should be able to just still take it off with one hand, but I don't know. That's just something I do. Okay? I'm going to get my needle ready. And one other thing I do, just like, because I think it helps, is when I have trash like this on the table, I throw every piece that I don't need on my table, I throw it away. Because otherwise, it just clutters your mind. Okay? And then one other thing I do too is I take this off and I just kind of twist the catheter up off of that, because sometimes it can stick. So I just kind of twist it, because you don't want it to stick when you're trying to get it in the patient. And then I put the cap back on until I'm ready to use it. And I don't push it all the way on, you know, just like leave it loose, because that way it's going to be easier to get off. Okay. And then my flush. I'll have my flush ready. Now, for tomorrow's purposes, normally my practice is that I hook these up and I draw my blood off of my line. But for tomorrow, we're not doing that. So what you're going to do is hook up your saline, prime your line. Now this little cap is gone, so we're going to pretend like that had a cap on it. Prime your line. I didn't like that. There we go. So now you have saline all the way through there, right? And you need to keep your cap on there. Again, just keep it on loosely. That way you can just pop it off when you're ready to use it. Okay? And then keep that on there. And that should be it. Okay. Gauze is your best friend, and you'll know why. Okay, so once you've picked your site, I'm going to go right there. These things, you just squeeze them, and they break. Okay, you got to squeeze kind of hard. So you're going to get your site, clean for 30 seconds, and let dry for 30 seconds, right? Same thing with your angle that you do for a butterfly stick. Only the tip. And in fact, when you get your needles, you'll be able to see there's a little line. You won't be able to see it until you get one in front of you. Where the catheter comes over the needle. That should be really all that you need, where you see that little line, but sometimes you have to go in a little bit more, okay? And again, I don't know that this one has blood in it, so we might not get a flash, but, okay, so it's dry. You're gonna go in with the purpose, and I felt my little pop. Now, normally I would have blood in the chamber here. Your chamber's right here. See how I kept my window still? And I know I'm in the vein because I felt that little pop, because it's a mannequin. You won't always feel that, okay? So from there, if you have this IV tomorrow, you're gonna push, see, watch these two fingers. Watch all these fingers back here. These do not move. My pointer finger is the only one that moves. I can draw it back. The skin's thick. Okay, so notice, this finger is the only one that's moving the catheter. If you move these ones, now you're moving the needle, okay? So this one is the only one that moves, and it pushes it in. Now the hub is flush against the skin, and now I can pull these fingers back until I hear it click. One more time?
Yeah.
Okay. Because this is like this is the trickiest part. Okay. So, hold it tight. Now, you might need to be holding the skin taut like that or whatever, depending on the patient, okay? But for this purpose, we're just gonna do this. So, I'm gonna go in with the purpose. I felt a little pop. Notice how far I put that needle in? Not very much. I got my flash in the chamber. So this finger is going to be the only one that moves. And the needles are good about going into the body because all the blood's flowing that way. You shouldn't meet a lot of resistance. If you do, you might need to consider something's going wrong, okay? So now that we're flush against the skin, this finger can't move anymore. I still need to get that needle out. So now I'm going to pull back with those fingers until I hear a click. Anybody want one more time? We're good? I'm going to click it out, okay? Hear that click? Okay, now, this is why gauze is your best friend. This is my personal practice. I always put it underneath there or sometimes fold it up in twos and just kind of lightly place it underneath there because you're going to occlude the vein up about here. Now, keep in mind how long that catheter is because you have to occlude above the catheter. If you just occlude on the catheter, blood's going to come out. So you have to occlude above the catheter. If you need to, use more fingers than you need. But that's also why I always have this all the time. I'm really bad at occluding a vein. I always have just like a couple drops of blood, and that's why I always put that there, okay? So you occlude there with like 2 or 3 fingers back here, and then you're going to anchor. This might be a little bit harder to see. Here, there we go. Perfect. Okay, so you're gonna hold there, anchor there, and if I had this a little bit more pressure on the table, that'd be better. Oh, I got blood return. Why is there blood return now? That makes no sense. Anyway, so stabilize your hub. Always stabilize, right? And now you're going to take that off. So now, this is where blood would be coming out, okay? Except you're holding pressure. So you're occluding it. And that's why, because you need time to be able to connect your extension tubing, okay? So let me put this back down here. Thank you. So when I took that off, if I just had it like this, blood would just be coming out, okay? It'd be a mess. But because I occluded and I held my hub stabilized there, and that's why I always have it real close nearby, because I like to just you just boom, boom, okay? Once you get that part on there, you're good. Nothing's coming out. And as long as you see why I say you need to stabilize that. So always keep your hub stabilized. So from here, now is the time where I would suggest kind of like taking a breather until you figure out what you need to do next. Because now the blood is stopped, you're fine, everything's fine, this isn't moving, blood's not going anywhere. So now take a breath tomorrow, and we're going to do the next thing, okay? So the next thing, if you're not drawing blood, which tomorrow we aren't, pop the tourniquet, okay? And you're going to flush.
Do you draw back a little bit first to see if
you could.
Or you just flush?
You could. And because I normally draw the blood off, I don't normally, but you could actually. Perhaps you should. However, you don't have to, and if you don't draw back first and you just flush first, if you're meeting any sort of resistance, stop and then consider drawing back, because that might mean you're not in it. Okay, if you continue to flush, you'll blow the vein and it's painful and traumatic. Okay, so now I know I'm in, and you keep that stabilized. Take that off.
How much normal saline are we going to be putting into
A couple mLs.
Okay, not the whole thing. We're not.
No.
Okay.
No. And if they're not comfortable having their IV flushed, don't even flush it.
Okay.
Get a stick. And in fact, the other instructors may just want you to get a blood return. But I like you guys to get practice. They might just want to see the flash, which is fine. But I think you guys need to get practice with flushing and seeing how that feels. So, okay. Okay, so now I have that there. Now my tape is there. Now my hands are free. Okay, so if you need to take this moment to take another breather, you can absolutely do that, because now everything's stable. And then you just put that there. Some of them have like a little, some kits have like a little tape thing that they want you to put on over it. It's the 3M company that makes it, and I actually really like that idea, because you'll see some nurses who do like the chevron thing up over it, or they'll like just tape it like crazy, and I'm like, why are you doing that? Because it's going to be more to take off, and it's not even doing anything. So they just want you to take like a little strip, and sometimes they'll still do this if a kit doesn't have it, and you just put it like that. You don't tape it like tape the thing down, because otherwise it's going to move the catheter. You just tape it along with how the catheter lies. Okay? And then you can put that over there. And then last thing you do is tape the little pigtail. You can tape it wherever you want. You can tape it there, you can tape it there. Sometimes on the AC, I like to just tape it straight down because it's more comfortable. So, whatever you want to do. Okay. So there. And then take that off. This needs to have a cap if possible. Okay. Now, taking it out, so much easier. Remember I told you there should never be an excuse for an elderly patient to have a skin tear. Use your alcohol to get this off of them, okay? So you'll just try to pull up a little corner there and just keep using the alcohol until you get it off of them. That's, I think, prevented so many times me having a skin tear. And then you just keep working at it. Some people you don't need to do this. Some people you can just take it off. Okay, but I'm pretending like this is an old person, and so you just take it off all the way there. Okay, so now in a normal person, you're going to keep that stabilized because you still don't want that moving inside the vein. And these guys stick a lot harder on the plastic arms than they will tomorrow, okay? So don't let that make you nervous. So you're going to stabilize. Same thing like the blood draw. Fold it up into fours. I put it over that way. We're good there. And you can use tape or the Coban, which is the non-adhesive bandage. And you're good. Okay? All right. Any questions? Okay. So go ahead,